out that follicular genesis, which is that growth of a follicle that carries the egg from the primordial follicle all the way to the ovulatory stage, can take about 10 months, so almost a year. That being said, I do feel that making these diet and lifestyle changes, supplements, herbs, acupuncture, all create a better environment for that follicle and that egg to develop in along the way. And I have seen changes for women within 2 months, 3 months. So even though this follicular genesis process is long, bathing that growing egg and that growing embryo and that lining in good nutrients and a good environment, less inflammation, it can help with the outcome even before that 1-year mark. So no matter where a woman is at in that journey, I encourage them to make these changes. It can only help. For men, spermatogenesis is a little quicker. Things are a little easier as usual. People joke that men cut out soda and they lose 10 pounds, and it's about the same thing with sperm. So making some diet and lifestyle changes yields big positive changes in sperm health in a short period of time. So I just wanted to briefly talk about, since we're working with fertility patients, the importance of understanding when to refer. So the American Society of Reproductive Medicine is an excellent resource for providers and for patients. They have a great patient website where patients can learn about different treatments and different conditions, and it's a wealth of information. If you're interested in practicing reproductive medicine, I encourage you to join. It's a multidisciplinary organization. But here they made a committee opinion in 2023 that defines infertility. And I'm going to go down to the third point here, and that's when to refer a patient to a reproductive specialist, to an REI, reproductive and infertility doc. So they should have an evaluation initiated at 12 months when the female partner is under 35. So if they've been trying for at least 12 months and have not gotten pregnant and the female is under 35, then it's time for them to see a reproductive endocrinologist. If they have been trying for 6 months when they're 35 or older, they should be seeing a reproductive endocrinologist at that point. If you have a patient that's 40 and they're just starting to try to conceive, it's important that they have an immediate evaluation to make sure nothing's going to stand in their way, because time is of the essence when it gets to that point, and we don't want anything to hinder their progress. So I think a big concern about patients when being referred to reproductive endocrinology is they automatically assume that means IVF. And I really strongly encourage people that those physicians are the best ones for making an appropriate diagnosis. They have the most experience with fertility, and they can make the best evaluation of that patient to then let the patient know what their options are. And very, very, very uncommon that it starts with IVF. Sometimes it's a necessity if there's issues with tubes or if there's a genetic disorder, things like that, to jump right into IVF, but it's pretty uncommon. So I encourage people to get that evaluation at the appropriate time. Next, I'd like to talk a little bit about the hormones that are involved in the reproductive cycle. So these are messages or signals. Our hormones say to the body, do this now and do this now. And it's carried by the blood, guiding the flow. In Chinese medicine, we say, of the yin and yang in the reproductive cycle. And we'll talk more about that. So this is the menstrual cycle, and it's one of the most beautiful things to me in Chinese medicine. It's, I think, what got me so excited about studying women's health and fertility in relationship to Chinese medicine. Chinese medicine is all about balance of yin and yang, of qi and blood, of all these different substances in our body so that we can maintain health and have our body function optimally. And ideally, we have, the most normal menstrual cycle is ideally a 28-day cycle. We're supposed to have a 14-day follicular phase, which is the first half of our cycle from the first day of bleeding to ovulation, and a 14-day luteal phase from ovulation to the next bleed. And so already we see this balance presenting in the menstrual cycle. In that follicular phase, we'll talk more about this, but it's the yin-dominated time of the phase or of the cycle. We are building a lining with blood. We are growing an egg, which is a yin substance, that tissue. We're building and preparing for this time that the egg is being released. And that yin gets so full that it bursts into yang energy, which is the luteal time, the luteal phase in our cycle. It's the time that our temperature rises. It's that fire, that warming, the holding and lifting and traveling of the embryo and implantation. So it's the activity. Yin in Chinese medicine is more of the material foundation in our body, and yang is more of the activity in the body, the energetics there. So we have this beautiful balance that presents in the menstrual cycle, and it also gives us a lot of information to see when things are out of balance and what might be going wrong, which I'll talk about in a little bit. So one of the primary hormones in our menstrual cycle is estrogen, and there's 3 forms of estrogen, estrone, estradiol, and estriol. But estradiol, E2, is the predominant estrogen during our reproductive years. It dominates the follicular phase. It's produced mainly by the ovaries, but also by the adrenal glands and the fat cells. And 95% of E2 is secreted by that dominant follicle that's growing from our period. This dominant follicle comes up and is growing the egg inside until we have ovulation, and that follicle releases that egg. So with the rise in estrogen, we have LH receptors that are in our brain, and they initiate an expression to mature that follicle and cause it to produce more estrogen. When the estrogen comes to a spike about 34 to 36 hours before the egg is released, we have this threshold that causes LH to be released and triggering ovulation. In the follicular phase, estrogen helps to grow that endometrial lining. It supports the production of fertile cervical mucus, which allows the sperm to travel. It also lubricates inside of the fallopian tubes so that embryo that was created in the fallopian tube can travel to the uterus. And in the luteal phase, that follicle, once it releases the egg, becomes the corpus luteum, and it continues to secrete small levels of estrogen. So as far as a traditional Chinese medicine connection, we have yin substances in the body when it comes to this estrogen. It causes things to be moistened and lubricated and proliferating. It's growing that endometrial lining, and it's the foundation of our yang. So if we don't have a good follicle and a good egg, we will not have a good corpus luteum once that egg is released. So therefore, our progesterone production will not be as good, which is that yang part of our cycle. So really yin is that foundation for our yang to really thrive. So estrogen and yin continue to support yang throughout the luteal phase. Next, I wanted to talk about luteinizing hormone, or LH. It's produced by the brain and the pituitary gland, and it's the important hormone for ovulation. So rising levels of estrogen, like I talked about, initiate that LH. And in a positive feedback loop, it makes more estrogen, and it continues until the LH triggers ovulation. So this is what's being tested when women use the OPKs, or the ovulation predictor kits. And some of them will also test for estrogen, but the primary function is for testing that LH. We are testing for that LH surge, which LH is going to go up and it's going to come back down pretty quickly. So women typically test once a day. It's usually recommended that it's the second morning urine, so that it's not super concentrated like the first morning urine is. And we will either catch it, that LH surge, on the way up or on the way down. So if we get a positive on our OPK test, that means we're going to ovulate within 12 to 48 hours. If you caught it on the upswing, it's going to be closer to that 48-hour mark. If you caught it on the downswing, closer to the 12-hour mark. But we don't know what time we caught it at. So we just have to know that that's the window that we will ovulate in. One problem that comes up is for women with PCOS. They often have high hyperinsulinemia, high blood glucose, and this increases the baseline LH that they have in their bodies. So sometimes the ovulation predictor kits will get confused, and we have this baseline elevated LH that messes up the tests, and we don't get a clear reading. Either they get multiple days of high LH, or they get no indication that there was a surge. Sometimes they can start to look like they're surging, but then no ovulation happens, and they may not track it any further, and they might ovulate later. So it gets a little tricky. The ovulation predictor kits are not a guarantee, but they are very helpful for predicting ovulation. a TCM connection here, ovulation occurs when, like I said, that yin becomes so full it bursts into yang. And the liver is one of the most important organs at this time. It's important for storing the blood, for building that lining, and for ensuring that free flow of qi, which to me, I think about the liver a lot like the hormones that are in our body giving signals. So we call the liver the general in the body, and the general tells the body what to do, just like the hormones do. So if the general is disturbed by stress or emotions, it might not be able to do its job very well, and it might not direct ovulation very well. So we might get delayed ovulation, or painful symptoms at ovulation, just trouble with that transition that's happening in that big hormone flux. So both are vital for that proper menstrual cycle, and the liver supports this transition. And OPK tests can tell us a lot about the liver qi because it tells us how well the signals are working in the body. Next, I'd like to talk about progesterone. This is the hormone that dominates our luteal phase. It's produced by the corpus luteum, which was that follicle that was left over after the egg was released. It helps to convert the endometrium to its secretory stage to help prepare the uterus for implantation of that embryo, and it increases the body temperature. The temperature increase, interestingly enough, is seen in all mammals, so it's thought to be advantageous to the survival of the embryo. And in Chinese medicine, we always talk about warming the uterus, having the uterus be warm and a very nurturing place for that embryo to grow. Progesterone levels start to rise after ovulation, and they reach their peak about 7 days after ovulation. So if a woman is unsure if she's ovulating or if she has ovulated, they typically will do a progesterone test at cycle day 21, which if we're assuming a 14-day ovulation, then we're assuming that it will be at its peak 7 days after ovulation. And we typically see a 10-fold increase, at least in progesterone after ovulation. So it's very clear and easy to tell that a woman has ovulated. Their levels will go from like 0.1 to 0.7 in the follicular phase, to 10 to 20 in the luteal phase. So it's pretty obvious that ovulation happened. If there was no conception, then the levels will start to decrease after that 7 days. And that withdrawal of progesterone will cause menstruation to come on. If there is conception, then progesterone production continues until the placenta takes over at around 8 to 12 weeks is typically where we see that placenta take over. And as far as our TCM connection, that yang energy that's happening in the luteal phase is used to support that travel and implantation of the embryo, that action. It's helping to raise the body temperature to warm the uterus, and it helps to hold and nurture the fetus. So here are some parallels between traditional Chinese medicine and Western medicine, according to, I would say, one of the foremost instructors on Chinese medicine and infertility. Her name is Jane Littleton. She has several books and classes if you're interested. So as far as gametes, egg or sperm, in Chinese medicine, we equate this to our jing. This is like your DNA that you're passing on to your offspring, and what we received from our parents. So it's something that we get when we are conceived and born, and we can't make more of it. So you don't want to use it up. You don't want to burn the candle at both ends and use up your jing. It's something that's sacred and should be cared for. Influencing the influence of our sex hormones. This is guided by the kidney energy in Chinese medicine, particularly the yin and the yang energy. Again, that yin is like the material, the yang is like the activity. And I would like to add also the liver. Like I mentioned, it's really important in those transitions, directing ovulation, directing the period to start. And then the influence of the hypothalamus and pituitary, or I like to think of our like HPA axis or our nervous system, the hormone balance, like with cortisol and things like that, we equate that to the heart. And I think if you've worked with fertility patients, you know that there is a lot of emotion that goes into working with fertility patients and the fertility journey. And one special thing that I like to share with them is Chinese medicine talks about the Bao Mai, which I put at the bottom. It means uterus vessel. And this is a special meridian that travels from the heart to the uterus. And each month it allows blood to flow from the heart to the uterus, nourishing ovulation, nourishing that embryo implantation, and supporting menstruation. One meditation that I like my patients to do is to think about filling their heart with love and sending that love and warmth to the uterus. So that's a really nice thing to do in meditation or during an acupuncture treatment. Next, the ovaries, uterus, lining, and cervix, all the female reproductive organs are called the big U uterus in Chinese medicine. So when we say uterus, we're referring to all of those things. And in that list, it should also include little u uterus, the actual physical uterus. In Chinese medicine, the uterus is called zigong, which translates to baby palace. And a lot of my patients like to learn that and think of their baby palace and keeping it warm and nourished and loved. So the actions of estrogen in TCM terms, it's used to promote the growth of the follicle and the egg, and this is the yin of the body supporting the action of the jing, which was like that DNA material. It stimulates the cervical glands to produce fertile mucus. Again, that yin is the material and liquid foundation in the body, so it helps to create fluids. It stimulates the cells of fallopian tubes to produce nutrients and mucus along their lining to help that embryo travel and be nourished. It's a long journey. It's a 5 or 6 day journey for that little embryo to travel before it can implant and get nourishment from its mom. So it's really important to have those nutrients and good mucus in the lining there. And again, the yin is creating that fluid. So this can help us with our diagnosis. If we're seeing issues with egg quality or the difficulty in producing a good follicle, we might think of a yin deficiency. Or if a woman tells me that they don't ever see any cervical mucus, they're not getting this egg white cervical mucus, that would make me think about she needs to have more yin. We need to nourish her yin, whether that's through food or herbs or acupuncture, I would think is not as strong of a way to build a material substance as taking in a substance, but we can still try to support yin with acupuncture as well. And then the actions of progesterone, we see that it lifts the body temperature. This is the yang energy warming the uterus. Progesterone thins out the mucus secretions because it's warm in the tubes to allow the embryo to pass. So this helps because yang transforms fluid in the body. It like heats it up and lets it steam off and clears dampness. Progesterone halts production of cervical fluids. So typically in the luteal phase, the cervical mucus dries up, and this is because of that warmth in the body. And again, if we're seeing things like the body temperature not rising, I will show you a basal body temperature chart soon. We know that we're having issues with yang energy in terms of Chinese medicine. So that brings us to charting the menstrual cycle. I find this a really valuable tool if you have women, especially women that are trying to conceive before they're using fertility treatments or medications. It also gives women feedback on how their treatments are going. If you're working with them with the acupuncture, herbs, supplements, lifestyle changes, any of that, you know, the marker of success is a positive pregnancy test, which they only get a chance to see that once a month. And sometimes it can take several months of doing this work to see that result. And having a gauge like the basal body temperature chart and seeing how it's changing and improving and becoming more balanced can be a big motivator. It can give women a lot of feedback to confirm ovulation. It's not a good predictor of ovulation, but it's a good confirmation of ovulation. Sometimes taking temperature every day and tracking like this can be stressful for women, then I do not recommend it. But if it's not a stressor and they find it helpful and informative, then it can be a really nice tool to use. There's lots of things that we can wear these days. Like I have an Aura ring, or there's a Whoop band, or there's a one for fertility that I can't remember the name, but there's things that people can wear so it tracks their temperature at night and they can just check on an app and it's all right there for them. Or women can wake up first thing in the morning when they wake up before they get out of bed or move around. They want to take their temperature. It can be oral or vaginal. And they want to try and be asleep for at least 3 hours before taking that temperature. Ideally, the same time every day. If you're not taking it at the same time, then tracking what time they took it at so you can see if there's an anomaly in the chart, and the same thermometer. And so we're just looking for patterns. So you want to keep things the same so the pattern can be consistent. Another thing that they can chart is their cervical mucus, because as they go from their period to ovulation, that cervical mucus will grow in and change. So it will be first sticky, and then it'll become creamy, and then egg white and very slippery and wet, and that's the fertile cervical mucus. So tracking that in conjunction with temperature and OPKs can give us a really nice picture of what's happening at ovulation. Let's see, there's a great resource. I love this book, Taking Charge of Your Fertility. I read it when I was like 21, and I couldn't believe how much I learned and how much nobody taught me about my own body and menstrual cycles and what to expect each day. So every time I give it to a patient, she reads it. She's always so grateful because nobody's ever taught her that much about her body before, and she really loved learning about it. So I highly recommend that book. So back to this picture of our follicular phase and luteal phase. So in that follicular phase, it's the first half of the cycle from bleeding to ovulation. Cycle day 1 for a woman is her first day of true bleeding. Not spotting. Any spotting that happens before bleeding would belong to the last cycle. This follicular phase is dominated by estrogen, and it's yin and blood focused in terms of Chinese medicine. Ideally, it's a 14-day length. But this is actually the part of our cycle, the phase of our cycle that changes. So it's the length of the follicular phase that will actually determine the length of the entire menstrual cycle. So if a woman ovulates on cycle day 7, she will get her period 7 days earlier than expected on cycle day 21, most likely. If she ovulates on 14, she'll get it at 28. If she ovulates at 21, she'll get it at 35. So it's that ovulation that's actually changing the length of our cycle. The luteal phase is the second half of the menstrual cycle from ovulation to bleeding. It's dominated by progesterone, and in Chinese medicine, we say it's yang and qi focused. Ovulation to the start of bleeding should be consistent. So that luteal phase should be consistent because it is dictated by the life of that corpus luteum that released the egg. So again, that progesterone is going to rise. If there's no conception, it's going to fall, and we should get our period. So it should stay consistent. Normal is ideally 14 days, but anywhere from 10 to 16 days can be considered normal. If it's below 10 days, that's considered a luteal phase defect, and I would be concerned about progesterone for that person, most likely. If it's longer than 18 days, that's confirmed ovulation. I'm sorry, that's confirmed pregnancy, even better. So luteal temps are typically more stable. So you're going to see them be more consistent. I like to see them averaging around 98.2, 98.3, 0.4, somewhere in that area. And that's because the progesterone that's dictating that temperature is coming from the corpus luteum in the ovary, and it's less affected by external factors and emotional stresses than the hypothalamus and pituitary that are affecting that estrogen production. So we sometimes can see really crazy temperatures in the follicular phase, but we should see more consistent temperatures in the luteal phase. So this is what a basal body temperature chart looks like for a normal 28-day cycle. Again, that follicular phase is that number 1 area. That's the yin time of our cycle. The luteal phase is the number 2. That's the yang type of time in our cycle. We can see a temperature drop typically at ovulation. So we see it dropped all the way down to 97.2. And then there's a thermal shift that happens from ovulation to the next day. It typically is about 1 degree. We want to see it be at least a half a degree. It may not be all in that one day, but we want to see it climb to at least over a half a degree up. There's places on these charts typically to chart intercourse, to chart the menstrual flow and the cervical mucus. A cover line is drawn in, and it's typically drawn when we have 6 temperatures that are lower than where it jumps. So we saw that it jumped from 97.2 to 98.1. So that 98.1 was at least 0.2 degrees higher than the previous 6 temperatures. And when we see that happen, and it happens and stays up for 3 days, then that's confirmed ovulation. And when that happens, we can draw the cover line 0.1 degrees higher than the last 6 temperatures before ovulation. And I know that's very confusing, and it's all in that book, Taking Charge of Your Fertility, if you're interested in learning it. I recommend checking it out. So here we're talking about the follicular phase and when the temperatures are too low. These are temperatures that are at the bottom of the chart in that follicular phase, and they're below 97. So they actually make a chart that has 1 degree lower temperatures, but from a Chinese medicine perspective, this is concerning to have temperatures that are that much lower. I typically want to see my follicular phase temps averaging about 97.5. They're going to jump around, but having it be about mid 97s is where I would like to see it. If they're too low, I start to wonder, how's the thyroid doing? Or do we have a general yang deficiency and we need to warm that body up? In terms of Chinese medicine, we're going to focus on warming the yang energy, and that is energy that we see in the spleen and kidney in Chinese medicine. So we'll put our focus there with acupuncture, moxibustion, which is the burning of an herb called mugwort, as well as herbs and our food sources. So next we have temps that are too high in the follicular phase. You see that I mentioned that they should be mid 97s. These are 98s or upper 97s consistently. We might think about the thyroid again. Is it hyper this time? And in Chinese medicine, we talk about internal heat. So our treatment is going to be to clear heat. And one interesting thing to note that I had learned about was that if these temps are only high during the period in that early part of the follicular phase, it can possibly be linked to endometriosis, where we're having bleeding in the pelvic cavity that's not coming out of the body. So in Chinese medicine, that yang, that heat cannot be discharged from the body, and it's still present, and it's causing those temps to be elevated during that time. So just an interesting thing to correlate to see if that's what's happening with your patients. If so, with endometriosis, you would be addressing blood stasis. Here we see a follicular phase that's too long. This is way past the 14 days that we want to see that egg develop and be ovulated. So ovulation here is delayed. This could be because we don't have enough blood and yin to help build up that lining and build that good quality egg and follicle to be released. It could be because there's a Jing deficiency. We talked about that nourishing the egg. If that egg and that follicle aren't strong enough, they can't produce enough estrogen to trigger the brain to release that LH and cause the body to ovulate. So we really want to have those things go well, that quality of the egg and follicle to be very strong and healthy. Sometimes women are given things like Clomid or Letrozole to help induce ovulation. Those medications help make those follicles stronger so that they can produce more estrogen and have a more consistent ovulation happen. Another indication could be liver qi stagnation. So we talked about the liver having to be balanced and able to dictate that free flow of qi and the movement of that transition from yin to yang. And if it can't do that, if stress is too high, it's going to delay ovulation. I would think of that as stress and the hypothalamus pituitary ovarian axis and adrenal axis. And, that stress is messing up all of those hormones and delaying what needs to happen. So in terms of Chinese medicine, we call that liver qi stagnation. In terms of Western medicine, we need to manage that hypothalamus pituitary axis. Okay. So next we see a luteal phase that's a follicular phase that's too short, which does not allow for enough time for the egg to mature. So here we again talked about that yin building up the egg and the follicle. And so this could be a yin deficiency. Often there's heat involved that's speeding things up and making things go too fast. And when we say Shen disturbance, that can be stress or mood changes that sometimes bring dysfunction to that hypothalamus pituitary axis again. So here we see a really unstable follicular phase. The temperatures are all over the map, up and down, like a seesaw, or a sawtooth, I should say, the top of a sawtooth. So these are dramatic changes in the temperature in the follicular phase. These luteal temps are typically more stable, like we said, because of the progesterone from that corpus luteum. But here in the follicular phase, it's more impacted by emotions and external stimulus. Here we definitely are thinking about stress and liver qi stagnation and helping with mood and getting those temps to be more consistent and even. Okay, so sorry, I got to move my screen here. Now we're into the luteal phase. And in the luteal phase, here we have one that's too short. We talked about how normal is 10 to 16 days, ideal is 14, 11 to 12 is okay. We don't want it less than 10. So here we have a 9-day luteal phase. This would be a kidney yang deficiency. That yang is supposed to support that entire luteal cycle, and it's not. So the degree of yang deficiency, if it's very severe, would make a very short luteal phase. If it's longer, there would be less severity to that yang deficiency. I find charting very helpful to determine if there's something going wrong in the luteal phase, because a lot of women, they know how long their period cycles are, but they may not know exactly when they're ovulating. So it's hard to tell if there's an issue with the luteal phase or not. So giving us some temperature charts to see if anything's going wrong is really helpful. So here we have a luteal phase that is too low. Again, I would love to see it in the low 98s on average, and we want to see a jump in that temperature, a thermal shift of at least a degree, and here we're seeing less than a half a degree. So this is a weak ovulation. There wasn't a strong follicle that's able to produce strong progesterone, and therefore we have weak kidney yang energy. So here we want to tonify not only the yang, but we want to help build that foundation for yang by nourishing the yin, nourishing that egg and that follicle. Okay, we have luteal phase that has an unstable sawtooth, just like we saw in that follicular phase where it's up and down. We have lots and up and down of up and downs in that luteal phase here, and we don't want to see that because that temperature should be consistent because of that good progesterone production. Here, again, we can have instability with that hypothalamus pituitary ovarian axis, the heart and liver chi. Plus, we're seeing some yang deficiency for not creating stable temperatures with good progesterone function. Here we have a luteal phase with a big dip, and that's not good. We want to see that progesterone keeping all the temps high. This can indicate actually high estrogen in the system, kind of messing with the balance of the estrogen and progesterone that are supposed to happen. So we want to nourish and tonify that kidney yang energy. And here we have a slow to rise. So remember, we want to see that big thermal shift from ovulation to the next day. And here it's just kind of trending up really slowly. This is showing that there's some weakness in the kidney yang, possibly again, some yin deficiency because we're not building a good follicle, and also some liver qi stagnation. So like I said, if you have patients who do these charts and see some of these issues coming up and then you apply treatment and their next chart looks better, they're going to be so happy even if it's not a positive pregnancy test, because they're seeing changes and having control and able to impact, what's happening in their body. It's really empowering. Here we see an early decline, so that temp is dropping below the cover line before the period starts. There might be spotting associated with this. This we would want to support, again, the kidney yang and the spleen qi, which helps hold the blood and lift and raise those temperatures again. And then this is a good one. We have a long luteal phase. It's more than 18 days past ovulation, and that's usually a confirmed pregnancy. So I would definitely have your patient take a pregnancy test. So I wanted to talk a little bit about male factor. Studies estimate that 1/3 of infertility is actually due to male factor, 1/3 due to female factor, and 1/3 due to both male and female factor together. So that puts about half of the reasons that there's infertility issues associated with the male. However, in my experience, I would say about 90% of the treatment that's done is done on women. So ethically, it's a little bit questionable to me to submit women to medical procedures and tests without knowing the quality and the of the partner's semen. So definitely having both people being evaluated at reproductive endocrinology if they've been trying for a specific amount of time, like we had talked about. The first step is typically a semen analysis. This is often the only thing that's done. I would say it gives us a lot of different information like volume, count, motility, morphology, etc., and can tell us if there's big red flags of things going on. But one thing it doesn't tell us is the quality of the sperm. So even though somebody comes to you and says they have a normal semen analysis, I would still highly encourage them to work on diet and lifestyle, which we know can have a big impact on their sperm quality, as well as all of these other factors, and they can have a quick response based on the changes that they're making. So whenever I typically have females that come to see me, but I always talk to them about their partner. We talk about supplements, what their health is like, and I tell them whatever you're doing with your lifestyle and diet, they should be doing too. So a Chinese medicine view of semen, again, it's a dynamic, fast-moving sperm, which represents that action and activity. It's the yang energy. And it lives within this moistening and nourishing environment of seminal fluid, which is that yin. So it's this interplay, again, of yin and yang working in balance so beautifully. When treating a sperm disorder, traditional Chinese medicine focuses on both yin and yang aspects, the sperm and the fluid containing it. Diagnosis in Chinese medicine for male infertility is pretty straightforward. There's a basic requirement for full reproductive potential with that strong kidney jing, so that genetics that we're passing on, plus that balance of the kidney yin and kidney yang that we just talked about. Most cases will be diagnosed with kidney yin or yang deficiency, but sometimes there's an infection, which would be the damp heat that we're seeing there with the diagnosis. Sometimes there's mechanical blockage like a varicocele, and that would be qi and blood stagnation. Both needing an integrative approach with Western medicine. So I just wanted to list out here some resources if you're interested in what I talked about here so that you can learn more. There's some books for clinicians, books for patients, organizations that you can join and be a part of, and continuing education that I have found very valuable. So acupuncture specifically for fertility, which is probably half of what I do, and I would say half would be the lifestyle supplements and herbs for sure. I take an approach with both things. In case you're not an acupuncturist and you're here, acupuncture is the shallow insertion of very fine, sterile stainless steel needles into the skin. And I like to talk to my patients about how we're trying to stimulate specific points to affect specific changes in the body. When it comes to Chinese medicine and fertility, the changes I'm looking to make are better blood flow to the reproductive organs, better endorphin release in the brain to help with that hypothalamus pituitary ovarian axis and other neurochemicals that we know acupuncture can trigger. We help improve the digestive system so that that functions better so we can nourish our body better. There's all sorts of things that acupuncture is doing, which I'll get to on the next slide, that helps with the fertility. It's been practiced for over 2,500 years. It takes a very individual and holistic approach, looking at multiple symptoms and systems at the same time. And acupuncturists often use other techniques such as electroacupuncture, which I actually use quite a bit for fertility, cupping, moxibustion, tui na, which is a form of massage, and gua sha, which is a form of scraping technique. So here are just a couple research studies that show acupuncture's mechanisms of action in terms of Western medicine. We know that we're enhancing microcirculation, promoting blood flow and vasodilation. There's a research study done on electroacupuncture actually in the low back and the lower legs, where they looked at ultrasound of the uterine arteries and saw that the electroacupuncture improved that blood flow within the uterine arteries, as well as raise the core body temperature. So we do have specific research around acupuncture and this improvement in blood flow to the reproductive organs. We also know it reduces inflammation, releases endogenous opioids and other neurotransmitters. We help to regulate the nervous system, and that which is very important with fertility, and we also can help reduce pain. So you may have heard of acupuncture meridians and points. This is what the system is based on. It's like a map throughout the body. There's 14 major meridians and 361 acupuncture points. And acupuncture points are located on the meridians where the needles are inserted to stimulate the body. And the acupuncture points are based on the anatomical structures in the body, such as the bones and different muscles. That's how we find them. So there's been a couple modern interpretations of meridians, which I just found interesting and curious. One is the neural hypothesis, where a lot of the meridians are mapped over larger mixed nerve bundles that project to the central nervous system, acting as road maps and stimulating the underlying pathways that can maybe account for a lot of the physiological changes that we see in the body. Another hypothesis is the connective tissue hypothesis, like fascia. Meridians are a representation of a network formed by interstitial connective tissue, and about 80% of the acupuncture points, when they study this, correspond to intermuscular or intramuscular connective tissue. One interesting fact about fascia is that not only can it conduct electricity, but it creates its own electricity. So it's kind of curious to think about placing a metal needle into tissue that is able to conduct electricity. So here's just a picture of some acupuncture points and how they're seen lying over a major nerve in the leg. Here's a picture representing the connective tissue hypothesis. On the right, you can see that there's the posterior fascial chain, and we have the bladder meridian on the left, which nearly mimics where that fascial chain is traveling. So some interesting findings, modern findings on acupuncture points. Research shows that if we block neural activity, it prevents the action of acupuncture from working. So definitely there's an involvement in the nerves when we're doing acupuncture. But research also shows that I'm going to jump down to the last one. Research also shows that acupuncture can normalize dysfunction in the hypothalamus pituitary ovarian axis in order to help regulate hormones. So we're doing more than just affecting the nervous system and the nerves. We're affecting that whole hormonal axis that's going on. And back up to that second one, research indicates that when organs change from a healthy state to a pathological state, that acupuncture points can actually shift from a silent state, meaning when you push on them, they don't hurt, to a sensitized state model. So when you push on them, they do hurt. They actually did this study on women with dysmenorrhea, or painful periods, and there was a point on their inner calf called spleen 8. And when they had painful periods, they were more likely to have tenderness at that point than when they didn't have painful periods. And when the painful periods were treated and resolved, they had less sensitivity at that point. One theory of why this happens is the convergence of the sensory inputs on what is called multi-receptive spinal neurons. So they receive information from multiple areas. So for example, they may be receiving information from the organs, the viscera, as well as the skin receptive fields, and having this interplay in those multi-receptor neurons. And maybe that's why we're seeing things happen to organs from the acupuncture points in the limbs. So this acupuncture research study is not about fertility, but I love it because I think it shows how powerful acupuncture actually is. So this was a prospective randomized trial that compared acupuncture to morphine, treating patients in the emergency room with renal pain. They had moderate to severe pain. And in these patients with acute pain, acupuncture was actually associated with more effective and faster pain relief and better tolerance than those that were treated with morphine. So in the two groups, 92% of the acupuncture group had success in reducing their pain by at least 50%, and 78% of the morphine group had success. The time that it took to reduce that pain was 16 minutes on average for acupuncture, and it was as high as 28 minutes in the morphine group. And overall, 89 patients experienced adverse problems. 85% of those were in the morphine group, and only 4 was in the acupuncture group. So that was pretty cool to see how strong of an impact acupuncture can have. Here's a Cornell study. It was in the Journal of Fertility and Sterility, and it found a clear link between acupuncture treatments and brain hormones that were involved in conception. Their research identified that acupuncture increases production of endorphins, which helps to regulate menstrual cycles and enhance conception. Here's one of my favorite researchers. You guys may know her. Her name is Lee Hollander Rubin, and she studied the impact of whole systems traditional Chinese medicine, because very often our patients are coming in and we're not just doing acupuncture. We're treating them with acupuncture, herbs, diet, lifestyle. So she did a retrospective review to look at what the impact of whole systems Chinese medicine had on her patients that were undergoing in vitro fertilization. And she saw that it was associated with a greater odds of a live birth in both donor and non-donor cycles, as well as a reduction in miscarriage. So in that first column, you can see those were the statistics for women who did not do acupuncture. In the second column, that was if they had acupuncture only with their transfer on the day of transfer. And they saw an improvement in birth rate, a reduction in miscarriage, and biochemical pregnancies went up a little, but stayed about the same, I would say. And then acupuncture was done leading up to transfer as well as on the day of transfer, which is how most of us would prefer to treat, not just on day of transfer. And that had the biggest impact on birth rate, reduction in miscarriage, and biochemical pregnancy. So unfortunately, a lot of the research that's done on acupuncture with in vitro fertilization is often studying acupuncture's impact on the day of embryo transfer only. We would love to work with patients leading up to that very special and important day to make their body more prepared to receive that embryo, to get them in a healthier place, like we talked about with that follicular genesis, and just making changes in the body takes time. So it's pretty incredible that we do see an impact on the transfer rates when we do add acupuncture on that day, but we see an even better impact when we prepare a body for that special day. Here are some systematic reviews and meta-analysis on acupuncture and fertility. The first one shows that acupuncture appears to be beneficial with women with poor ovarian reserve and with previous unsuccessful attempts at IVF. The second one shows increased pregnancies, live births, and reduced miscarriages when acupuncture was compared with no adjunctive control. And then the third one shows acupuncture given with embryo transfer improves the rates of pregnancy and live birth. So next, my second passion, which would be lifestyle medicine for fertility. I talk to every one of my patients about lifestyle. I find it to be essential in helping them prepare. I do try and meet them where they're at in their journey. I am not trying to force people to make changes they don't want to make, and I try and make the changes, you know, something that they can add to their life and make better and be sustainable and help them in the long run. Because if we're helping them make these changes before conception, my thought is they are hopefully going to have a better quality egg and sperm, making a healthier baby, but they're also learning the skills to help that child grow up in a healthier home and environment and have a healthier diet to then be healthier adults. So lifestyle medicine applies evidence-based whole person lifestyle changes to prevent, treat, and reverse health conditions. There's 6 pillars. We talk about nutrition, physical activity, stress management, restorative sleep, social connection, and avoidance of risky substances. Again, every single one of these is very important for fertility. So we want to let food be thy medicine and medicine be thy food. I always talk to my patients about nourishing themselves in every sense of the word. So we want to nourish ourselves with, of course, good nutrients, good nutrition, but we also want to nourish ourselves with good rest and good thoughts when we're preparing for a pregnancy. So here, talking about nourishing ourselves with good food, a lot of the evidence points to a Mediterranean diet as having a positive impact on both female and male fertility, improving menstrual regularity, IVF, as well as sperm parameters. So this is a really easy diet to recommend to patients because they have a lot of resources out there. There's a lot of talk about it. It's more of a lifestyle, and I would encourage them to give it a try. We do have some research on things that we know are absolutely detrimental to fertility. So things like trans fats, which now are labeled on products so they can easily tell if they're being exposed to those. Refined carbohydrates, white sugar, white flour, white rice. Those things are going to mess with their blood sugar, which in turn is going to wreak havoc on their hormones. And then artificial sweeteners, including stevia, has some research on a negative impact on fertility. So I would talk to people about, diet sodas and the coffee creamers that they use and gum that they might be chewing, different places that they might be exposed to these artificial sweeteners. And then added sugars, like we talked about with affecting our blood sugar, can negatively impact fertility. Here's just a few research studies that are out there. There are so many supporting nutrition and fertility. I also talk to my patients about moving their body. This is really important. One takeaway is that we found exercising more than 15 minutes on a regular basis is associated with better fertility. Another takeaway that we worry about is the other end, where we have people that exercise too much. And it seems like the issue is coming from an increase in So if you're a vigorous exerciser, what we want to do is increase calorie intake consumption in order to account for the energy loss, especially in the follicular phase. So if these women are working out really hard, they need to really ensure that they're replenishing what they lost with that exercise, or decrease the exercise. Both can be really helpful, especially if they have amenorrhea and are not ovulating. This is a really important step if that's something that they're doing, is exercising too hard. I like to tell people to leave 10% left in the tank for baby. So try not to exercise yourself to exhaustion, but leave some in the tank. Physical activity is particularly important for women with polycystic ovarian syndrome, PCOS. We saw that as little as 30 minutes of vigorous exercise 3 times a week can increase the chances of conception, particularly in larger bodied people. I am a big fan, on the next slide, of resistance training for women in particular, because it's not something we're talked to about very much. We talk a lot about cardio, but very little about building muscle, which is such an important thing for women, particularly in their 20s and 30s when these women are trying to conceive, because it's going to make for healthy bones later on in life. It's going to allow us to have healthy blood sugar levels, maintain our weight, particularly as we get into our 40s when muscle starts to decline. We want to start with some good muscle mass. It helps to improve our sleep, boosts our mental health, and very importantly for fertility, balances our hormones. So I usually give them these resources that I really like: the Resistance Training Revolution, if they're not have been exposed to resistance training before, and this book called Roar that connects our activity with our menstrual cycle. Next is stress management. So there is a lot of talk about bad stress and stress being bad for fertility, but sometimes I worry about the stress that this creates for women. So we often have a talk about good stress or eustress and bad stress, and also known as distress. And what we have learned is actually mindset really matters. So there was this big study of 30,000 US participants done, and they were asked, do you believe that stress is harmful to your health? And the results were astounding. Those who had replied yes exhibited worse health and mental health outcomes than those who had answered no. So over time, if we can develop a mindset that equips us to deal with challenges, then we can build resilience toward these stressors. There's a great TED Talk on this. And I like to talk to my patients about it. It's not about completely getting rid of your stress. It's about also practicing relaxation. So we're really good at practicing stress all the time. We have a lot of skill at that, but we don't practice relaxation, and we haven't built up our skill or our resilience by doing that. So the next thing I talk to them about is tools for stress management. Reducing our exposure to stressors is always a good thing. If there's ever a time to say no to things in your life, it's when you're getting ready to conceive, because every time you say no to the thing you don't want to do or is too burdensome on you, you're saying yes to that potential baby. So it's really an important time to be selfish, to put yourself first. But sometimes we have stressors we can't avoid, and so then we need to practice techniques that help us build resilience. So things like optimizing our nutrition, exercise, sleep, social connection, risky substances that we do with lifestyle medicine can all help. Time in nature is very helpful, forest bathing, things like that. But mind-body practices, incorporating those into our life, can be really instrumental in helping to build that resilience. So I talk to women a lot about mindfulness, deep breathing. I love 4-7-8 breathing. I often give them guided meditations. There's a program I really like called Circle and Bloom. They have fertility specific guided meditation programs based on different like IVF or natural conception, pregnancy, things like that. Positive affirmations, gratitude. I try and teach them skills around all of these things. And next is good sleep, such an important thing for healthy hormone balance. I think all of you know about the benefits of good sleep. It's easy for us to know about this. It's really hard for us to, I think, implement it and actually prioritize going to sleep at a good time and getting enough hours of sleep. But it's something that I really encourage my patients. I would say about half of them actually do that, and about half of them don't. So I teach them some things that are important around good sleep hygiene, consistent routine and bedtime, a good environment that's dark and cool, quiet, comfortable, not eating before bed, trying to not drink alcohol, good nutrition that helps supports hormones and decreases inflammation, decreasing caffeine, exercising, and then managing stress. The other really important thing that I talk to people about is helping to balance their circadian rhythm by respecting the light-dark cycles. So if you think about, 200 years ago when we didn't have any of these artificial lights, we had candles, fireplace, the sun. And so our bodies have been trained over, thousands of years to use light as a signal to be awake and darkness as a signal to be asleep or to go to sleep, fall asleep. So I think it's really important to respect this and to use that bright light in the morning to help reset that circadian clock. So getting outside if you can, getting in front of the bright light. If you're groggy in the morning, get yourself in front of some bright light and it'll help wake you up. In the evening, I really want people to be respecting not looking at screens, keeping the bedroom dark, dimming the lights before bed, about an hour before bed, 2 hours before bed. Sleeping in a very dark room. All of our cells have photoreceptors and can sense, even if your eyes are closed, that there's light in the room. So it's really important to be thinking about how we're impacting our brain and our body with light and darkness. I encourage people to try amber tinted blue light blocking glasses if they really cannot avoid the screens or lights in the evening. And it can be really helpful. So next is connection. So encouraging people to connect to themselves, to take time and read or rest or relax or meditate, to others, gathering a support system, asking for help. I started a couple years ago a fertility support program at my hospital where every Monday we meet on Zoom, and we have one Monday we talk about lifestyle changes, another Monday we have music therapy. We have a support group where we talk, and we have a stress management class. So really trying to create these connections for your patients if you're able to do that, and a way for them to not feel so isolated, as fertility is such an isolating journey, so that they can have that connection. It'd be really wonderful. Avoiding risky substances and toxins. So one big thing in our environment, unfortunately, is these endocrine disrupting chemicals. It's very disturbing that we have to work so hard to live in a clean environment or semi-clean. Our endocrine system is really fragile, and it produces our hormones, including our sex hormones, progesterone, estrogen, testosterone. And these chemicals can really negatively impact this delicate system. It mimics our hormones and looks like them and binds to the receptors, but it doesn't act like them. So it creates all of these hormonal imbalances. These endocrine disruptors include tobacco smoke, pesticides, herbicides, plastics, flame retardants, artificial fragrances are some of the big ones. So I encourage people, the best way to reduce this exposure, this is really particularly important for PCOS patients. Try to go organic where you can. I talked to them about the Clean 15 and Dirty Dozen that's on the Environmental Working Group, talking about meat and dairy products. Invest in plastic-free food storage, so trying not to have your food or drinks touching plastic as best you can. If at the very least, not using hot things in plastic. Choosing non-toxic cosmetics, body products, household cleaners. There's a place to find those things. No artificial fragrances in the house or on your laundry detergent or the things you're putting on your body. So no Glade or Febreze or plugins. All of those things can contain phthalates, which are a known endocrine disruptor. And actually on the list of things children, there is 5 chemicals that the American Academy of Pediatrics put out that children should not be exposed to, and phthalates are on that list. So this is also important for that child that is going to be growing up in that home. Wash your hands before eating, and then adding houseplants to your home. Houseplants actually can clear out 90% of certain toxins in the air, like formaldehyde and toluene, within 24 hours. It's pretty awesome. So a houseplant in every room. And then male fertility and lifestyle, like I talked about, is also dramatically impacted by diet and lifestyle. So studies actually show that the diet not only affects sperm, but also the health of the offspring just as much as the mother's diet during pregnancy, which is crazy to think about. So it's really important that men get on board with the fertility journey as well. Sperm are extremely sensitive to the effects of chemicals in the environment and food. Here's a list of things that should be avoided. Particularly, I would like to note marijuana as it becomes more and more available and legal. There's actually a whole plethora of research showing the detriment of marijuana on sperm in a variety of parameters: motility, morphology, count, all sorts of things. So that's something I typically ask about and encourage my patients to not do while they're trying to conceive. So I had the blessing of having a Vitamix Foundation grant us money to start a lifestyle medicine for reproductive well-being program. So I put all of these things together in a program for women, and we do it with shared medical visits and health coaching over an 8-week period. We have 4 shared medical visits that talk about nutrition, exercise, sleep, supplements, things like that. And then we pair it with health coaching so they can help make those changes in their life. So I tell you this as a teaser for our July panel, because this will be something I'll be going into more detail about, as well as we'll be hopefully talking about research and culinary medicine and other hormone programs and things like that for women. So we're still arranging that, but we hope you join us back in July. And that's all I have for you. So I'm welcome. I welcome any questions that you have. And again, I thank you for having me.
Christine, thank you so much. That was really a fantastic talk. It was so well balanced and integrative. You did a great job of putting together the Western and the Chinese. I thought it was a wonderful talk.
I appreciate that. Thank you.
There will be a recording. Unfortunately, we did start the recording a couple of minutes into the start of your talk, but the vast majority will be there. And it's going to be available probably in about a week, but everybody who's registered for this talk will receive a note advising when the recording is available. And just so you know, the AIHM is now putting all of its talks on its own YouTube channel. So even if you didn't sign up for the talk, you'll still be able to. I mean, anybody can access this at www.youtube.com/AIHM Global. And however, if you want to have a little heads up about when it's going to be ready, as I said, since you have registered, you will receive that note. Also, we do have time for questions and comments. We didn't specifically say, please put them in the chat or whatever, but usually people will do that, but I don't see anything right now. But if you do have any questions or comments right now, please feel free to add them to the chat or do the Q&A. And in the meantime, while people are maybe deciding whether to do that, I'd like to start off with one question that I have. And it's this: do you think that beefing up nutrition is really a sufficient counter to extremely vigorous exercise and its taxation on the yin and on estrogen production? And I just want to sort of or supplement that question by saying that a number of years ago, I had a patient who hadn't even had a period for 17 years because she was a compulsive, chronic, hard exerciser, like kickboxing and stuff. She was just addicted. And I just told her straight up and down, unless you bring that down significantly, you're not going to really have a good chance of getting pregnant at all, or even have a period. So she was very motivated and she did stop. And in a remarkably short time, she did have her period, and a remarkably short time after that, she had gotten pregnant. And
That's
then
awesome.
she had a miscarriage because she couldn't
Mm.
hold off the, the exercise. So then we had another serious talk, and she did lay off the real heavy exercise after that. And she got pregnant and kept the pregnancy and, delivered to term. And then she's had three other successful pregnancies since then. So I'm just saying that as a background, that's my experience.
Yeah.
I don't think no matter what kind of diet she had, that would have been enough to overcome that kind of exercise regimen. What is your opinion about that?
I agree with you. I was sharing the research that's out there, but I do encourage my patients to think about what they're asking of their body when they're trying to get pregnant, and that idea of if it feels nourished and safe and like it can have enough to give to another life. So I often ask them to realize that being your most physically fit and being ready to conceive don't really jive. And that usually is an aha moment for them. Like thinking about, I let them know, there's a time in your life where being your most physically fit, you can get back there and you can do that. But usually for most people, that doesn't go hand in hand with also being completely ready to conceive. So when they're trying so hard to conceive, I think they're willing to forego being their most physically fit, like, and have a little bit extra to give to that life. And so like I said, I asked them to leave 10% in the tank for baby and not work so hard. But also making sure they're nourishing themselves to replenish. Some of them feel, that emotional piece is so hard, and taking away their exercise. Like I don't want that to happen, but I usually don't want them to do cardio for more than 30 minutes. I talk to them about not sweating too much. That's that yin material that you're getting rid
Right.
of, particularly if they're yin deficient. That's a really hard thing on their body. So I think it depends on the person. Like if they're really excess and chi stagnant and that exercise helps them, I'm not going to encourage them to tone down as much as I would somebody who's yin and blood deficient, if that makes sense. But I still think they should be thoughtful and conservative with their exercise. I don't think that food is a complete replacement for that.
Well, somebody who has excess like that is probably not as yin deficient as my patient was,
Right.
yin and blood deficient. So,
And usually those
um,
excess people aren't exercising as much, and that's why they're
right,
yeah.
right.
So,
And there's all kinds of different exercise. I mean, you
right.
can still take walks, you can do yoga, you can do Tai
Yeah, I
Chi.
definitely want them moving their body every day in
Yeah,
some way. We want to move that blood and help with, those good endorphins and everything, but not necessarily to the extreme of being your most fit that you've ever been.
we do have question here. For BBT, what do you recommend patients who have irregular work shifts, such as nurses working at night, to take and record their temperatures?
Yeah, that's really hard. I would say that maybe BBT charting is not going to work very well for them. If they have a consistent schedule where they're sleeping during the day and they're asleep for at least 3 hours, they can try taking their temperature. I always tell people we're looking for patterns. Like, don't freak out if the temperature is not perfect every day. Just make a note on when you took it and what might be different. But if they're jumping from morning to night and everything, I mean, one, that's a really hard thing. I see a lot of women who are going through infertility that I think could be attributed to the irregular work shifts
Right.
and that circadian rhythm dysfunction there that's happening. So it's something to consider, even for a temporary basis, to maybe go to days when they are trying to get pregnant. And I really don't know if the BBT charting is going to work for those patients. They can try, but If it's not looking like it's showing them much information in a pattern, then that's probably why. So I also see a question about, I love the medical group visits. Can you please assist with more info for this? Well, I hope you join us back in July, because we'll definitely talk in detail about that. But our idea with the shared medical group, this is like a medical visit that's led by an APP, so a nurse practitioner or a physician assistant. We have a group of typically around 10 women. This group we have going right now has 11. And the intention is to educate on a lifestyle medicine topic during that time. We're typically together for an hour and a half, while also talking about their goals and struggles and things like that, and doing this in a shared environment with other patients. So they are able to have that support and that social connection. Sometimes people ask questions that other people don't think about, or they might have ideas or things that have worked for them when implementing those lifestyle changes. So it's really great to be in that group setting. And shared medical visits or group medical visits are billable to insurance. You would bill like an office visit code. I cannot do it because as a licensed acupuncturist in the state of Ohio, it's not consistently reimbursed for me to be paid for an evaluation and management code, but the APP is consistently reimbursed for that. So we do that in conjunction with a health coach, and then the health coach meets with them a week later, typically to talk about implementing the changes that were talked about, like nutrition, into their own personal life, because everybody's at a different place. We have groups where some people really are great at nutrition, they're dietitians or something, and some people, you know, all they can do is eat fast food most days of the week, and they need to learn different skills. So having that health coach to tailor it is really helpful.
We
So
do have
hopefully,
another question. Will we
yeah.
have access to the slides from today's presentation accompanied by an anxious emoji face, an anxious emoji smile, hopeful
Absolutely.
that you will
I
allow
saved
that.
it as a or as a PDF, and I can share it with whoever can disperse it. So if Peter, if you can do that out, I'm happy to email it to you.
Thank you.
I'm
Yes, we
also
will do
happy to
that.
put my email in the chat, and people can reach out to me, and I'm happy to share it with them that way too.
Oh, yeah, you can, I mean, it's up to you, but we'll be happy to distribute the, it actually, we will put an attachment into the same email that's going to tell you that the recording is available.
Oh,
So,
perfect. So I'll send
yeah,
it to
so
Peter,
if you
and
do
you guys will
that,
get that.
that's Christine. Um, Anybody else have any questions, comments?
I think there's one more question here about how did I start the support group. So the
Ah,
support group that I do is actually different than the group medical visits. It's a Zoom that I have, and I just started it with sharing with my patients that I was offering it. I have a flyer that I give out, and I told them that I was doing it because I wanted to create a place for safe and a caring connection between my patients, and a place for them to ask questions and to learn. So we started with just a once a month support group where me and one of the nurse practitioners from the fertility center lead the group, and women would join, and it felt like it needed to happen more frequently. So we changed it to a weekly thing. And I was able to have some of the practitioners in my department share some of that burden of meeting weekly. I do a lifestyle class once a month, as well as the support group once a month. And then one of our music therapists does a music therapy program. And then one of our holistic nurses teaches on stress management and resilience one of the weeks. So if you have any colleagues that you can share, you know, some of that burden with, it's pretty easy to start. I just have a Zoom link that I share on that flyer, and I pass it out. And I've had women join that were told by a friend of a friend, and all of a sudden they're joining. So word gets out that it's there. And I think women do need more of this support when they're going through fertility. So if it's something that you're interested in, I would say do it.
um, I don't see any other questions right now or comments. So, let me say that just to amplify on what Christine said a few minutes ago. Next month, we are going to follow this talk with panel discussion that's going to be practitioner oriented, as opposed to today's talk being treatment oriented. It's going to be called Strategies for Promoting Women's Health and Fertility in the Practice of Integrative Gynecology. And of course, Christine is going to lead off by talking about the 8-week program at UH that she has developed. And we are putting the rest of the panel together, but actually Dr. Amy Sapola, who was with us at the beginning, she is also going to be talking about yoga and culinary medicine as aids for fertility, but specifically, again, from the practitioner's standpoint about like what strategies to employ to, to get patients to come on board with these types of practices. And we've got 2 other people in the works. So if you have not joined our mailing list, please go back to the address at the beginning that Amy put on in the chat. And that is the Integrative Cleveland mailing list. And so we are able to, if you just join the list for free, you don't have to become a member of Integrative Cleveland or the AIHM, but you will receive our newsletters, and then you'll have the details and the information about next month's webinar as well. So I think that's all I have to say. Thank you again, Christine. Really appreciate it.
Absolutely. Thank you for having me again. It was really fun.
Okay, it's great. Thank you. And good night, everybody.
Thank you.